So let me talk about the political butcher, Daniel Andrews. If the circumstances in Victoria were not so tragic because they were avoidable, you'd have to say Premier Andrews has reached the stage of vaudeville. He was asked at the end of last week how the private security plan for guarding quarantine hotels came about. I'll talk to Mark Latham about this in a moment. His response, quote, "There is a decision to establish it. It then gets established. It's then run by multiple agencies. And beyond that, well, we can't be certain, we can't be sure, we can't answer many of the very important questions, really. Yet we can safely say many, if not all, of those the deaths in Victoria occurred as a result of allowing unsupervised guards to overseas hotel quarantine. The result? At least $12 billion wiped from the Australian economy, 400,000 people jobless, and the increase in effective unemployment could be anything up to 400,000. The bloke in charge, Daniel Andrews, says it's not clear who was in charge of the bungled hotel quarantine program. It's one thing to be run by fools. It's quite another to accept unthinkingly what the fools are saying. I mentioned last week the Lancet Medical Journal, an independent international medical journal dating back to 1823. It is regarded as a world leader in the publication of papers that have made a crucial contribution to science and human health. In a recent publication, it argued, and I quote, "In our analysis, full lockdowns and widespread COVID-19 testing were not associated with reductions in the number of critical cases or overall mortality." Well, as the alarmism continues, let's talk numbers. Australia-wide, there were 607 patients in hospital, 591 in Victoria. That means 16 throughout the rest of Australia. There are 51 in intensive care, 43 in Victoria, 8 throughout the rest of Australia. Yet people are terrified. Still, worldwide, 99% of all cases are mild. More people died last year of the flu with a vaccine than have died from coronavirus without one. In fact, the deaths worldwide so far from this virus are 733,000, but the deaths from communicable diseases so far, 7.9 million. We can't keep swallowing what's being dished out to us every day about another case here, 10 more cases there. No leader tells us how old these people are, whether they're mildly infected or seriously infected, and they never tell us the figures. I'm the only one who'll tell you that. Apart from Victoria, 16 in hospital across Australia, 8 in intensive care. Are we going to keep fighting this virus in this way? There's a massive human cost emerging. The cost of JobKeeper is now beyond $100 billion. The Prime Minister now at long last is talking figures. The federal government response is so far $314 billion. The states $45 billion. He is rightly arguing that the states should do more. But that's about $360 billion so far for 295 deaths. What's your maths like? That's $1.2 billion for every death. What will be left of the country if we keep going this way? We're now told that work-family conflict is driving a surge in mental distress of more than 1 million parents with primary school-aged children. There are 1.5 million Australians who are working parents of a child aged 5 to 11, and over a quarter of them are experiencing high mental distress. When is this nonsense going to stop? Locking people in their homes, taking people out of school, forcing people to live like battery hens. The draconian measures with massive policing powers, nightly curfews, some of the most extraordinary lockdown measures on the planet. Police able to enter your home with neither a warrant nor permission. We can't go on focusing just on deaths from the virus and ignoring the deaths caused by the lockdowns. We can't be willfully blind to what we're doing to young people who, apart from the mental anguish of all of this, are going to face the costs of it all in later life. At last, business seems to have woken up. Best summed up by the property developer Tim Gurner. I don't know the man, I've never met him. But he said last week, it's going to be catastrophic for the Victorian economy. It's policy on the run. This is the most ill-thought-out policy I have seen. It's like they made it up the night before. Which brings us to the architect, apart from Andrews, of this mess, the National Cabinet. What have these monthly meetings achieved if Andrews has not been pulled into line? If a National Cabinet's worth 2 bob, it makes decisions which are binding on all members. But the Prime Minister said the National Cabinet never agreed to border closures. the states closed the borders. The Prime Minister said the National Cabinet never agreed to keeping children out of school, but the states did just that. Yet when you want common agreement on quarantine to look after those most at risk and to stop importing the disease, the governments went their own way. I call that National Cabinet failure. My understanding is that at a federal executive meeting at the weekend of the Liberal Party, the Prime Minister was clear: do not criticise Andrews. He's doing his best. This is emerging as a strategy rotten with politics. If the polls keep showing support, I suppose they say, let's keep doing the same thing and bugger everybody else. The poll figures say these so-called political leaders who've put us where we are heroes. Surely we can't be that stupid. Is there anyone in this National Cabinet representing an alternative view, or are they all poll-driven? Lemmings. I'll tell you something. If they weren't on full pay and had to suffer the same conditions as those that they have created, they'd be thinking very differently. They won't wake up until we do, because they've got no experience of the appalling world they've created. One postscript. Is this a metaphor of the problem? The Prime Minister last week announced millions of dollars for mental health services and admitted it'll focus on young people who are in severe distress. Do you get the drift? Government decisions are forcing young people to the brink, and the best we can do is to say, well, we'll try to help you from going the whole way. Shouldn't we be curing the disease, not the symptom?